40% of Belize's GDP comes from tourism. Like Belize, most of the region is tourism dependent. So the health of the Caribbean economies is closely tied to the health of the tourism industry. But tourism is vulnerable to health and safety threats such as diseases, unsafe foods, and deficiencies in environmental sanitation. So back in 2016, Belize signed on to CARPHA's Tourism and Health Program. It is a regional early warning health system that aims to monitor visitors' signs of illnesses, and it immediately alerts health officials. Dr. Lisa Indar of CARPHA is in Belize to follow up on Belize's implementation of this program.
Belize started this program in 2016. They're doing pretty good. The program is geared towards really improving the health and safety, not just for our travelers, but for our local population. So today we are following up with things that we have done and how we can progress more in ensuring that hotels are registered, that if we have an illness that we respond quickly, and more importantly, building capacity, food safety training and standards and so on. So generally, the product that we are giving to our local public health as well to our visitors, it's a healthier, safer product.
This health surveillance system is being used to track signs and symptoms of an illness. CARPHA and the Ministry of Health say that the Tourism and Health Information System is highly confidential. It doesn't collect names or any other identifying information from visitors or staff. To date, 38 properties have signed on to the program in the Cayo and Belize districts. Antonio Agar of the Ministry of Health explains how the system works.
The system is actually designed to be installed in local computers in actual individual hotels and resorts. And it basically is accessible only to the managers and other persons who they give authority to. And they would basically just be briefed, which is part of the training today, in terms of what kind of symptoms and syndromes they should look out for, and also, be sensitive to whenever guests would present these things or mention it, and then they would then in turn enter this into the system, and that would be connected to us and be analyzed by us. We actually have a list of signs and symptoms that we specify to the owners and managers and also the staff as well to look out for. And that includes, for example, gastro, as you've mentioned, but also as well neurological symptoms, symptoms related to fevers, and other kinds of symptoms that could potentially be signs of something more serious. And the idea is not necessarily for the hotel owners or the staff to make a diagnosis, but more so for them to just indicate through the system that they have seen something related to health in terms of the patients or the staff. There's two basic routes that we would take. The first one being if it passes a certain threshold and it generates an alert, meaning that there are above the normal level of people with a particular kind of symptom or syndrome. Then in that case, we would obviously send out a team, public health team and other officers who would do a thorough investigation. Or it could be, if it's below the threshold where it's a low level, we would still, get in contact with the hotel owners and just make sure that everything's okay, and if, just to make sure that there's nothing unusual in any of the cases that they're reporting.
Dr. Inder says that the system can help participating countries respond to improve health, safety, and security of visitors and locals, and ultimately will help to safeguard the tourism industry.
If you have negative publicity, if you have people getting sick, and look at what's happening with measles and look at what's happening with DR, it brings you negative reputation, and then there's cancellation, and obviously then your tourism product suffers. So the idea of this program is to create a healthier, safer product so that we're improving your reputation and making sure your tourism is sustainable. We are implementing right now in 8 countries, many successes. Jamaica is a good example, Barbados is a good example, where they're implementing, they can easily pick up something very quickly before it spread, before it gets out there, and you're stopping it, putting measures in place so that you don't have increase, you don't have negative publicity, you don't have lawsuits on your hand.
Reporting for News 5, I'm Andrea Polanco.